Hello everyone, welcome to Simsad Aesthetics. I am a professional esthetician and cosmetologist. Did your face suddenly age after using GLP-1? You're not alone. Thousands are dealing with Ozempic face, sunken cheeks, sagging skin, and that deflated look nobody warned you about. The good news? These skin tightening treatments can reverse it. I am breaking down the exact procedures dermatologists use, including which one works best for your age and budget. Stay till the end. I will reveal the $1,200 treatment that works better than fillers for sagging skin. Subscribe first to get latest updates. Ozempic Face has become a growing concern among individuals using GLP-1 medications like Ozempic, Wegovy, and Mounjaro for weight loss or diabetes management. While these drugs are effective for metabolic health, rapid weight loss can lead to facial volume depletion, sagging skin, and an aged appearance. Fortunately, advanced skin tightening treatments offer a solution to restore a youthful, contoured look. Section 1. Understanding GLP-1 and its effects on skin. GLP-1, glucagon-like peptide 1, is a hormone naturally produced in the gut that plays a crucial role in regulating blood sugar levels. It stimulates insulin release, slows gastric emptying, and reduces appetite, making it a powerful tool in managing type 2 diabetes and obesity. However, one of the unintended side effects of rapid weight loss from these medications is Ozempic face, a term coined to describe the premature aging, sagging skin, and loss of facial volume that many users experience. Why does GLP-1 affect the skin? When you lose weight rapidly, especially with GLP-1 medications, several changes occur in the skin. Fat loss in the face. The face has natural fat pads that provide structure and youthful fullness. Rapid weight loss causes these fat pads to shrink, leading to hollow cheeks, sunken temples, and under-eye hollowing. Collagen and elastin breakdown. Collagen and elastin are proteins that keep skin firm and elastic. Sudden fat loss reduces support for these proteins, leading to sagging skin, jowls, and deeper wrinkles. Dehydration and reduced skin elasticity. Weight loss drugs can sometimes cause mild dehydration, making skin appear dull and less supple. Muscle atrophy, loss of facial muscle tone. Some studies suggest that rapid weight loss can also reduce muscle mass. Is Ozempic face permanent? No. While the changes can be distressing, they are not irreversible. With the right treatments, you can restore volume, tighten skin, and regain a youthful appearance. Section 2. Best skin tightening treatments for Ozempic face. 1. Radiofrequency, RF, skin tightening. How it works. Uses controlled heat to stimulate collagen and elastin production. Penetrates deep into the dermis without damaging the surface. Benefits. Non-invasive, no downtime. Gradual improvement over 2 to 6 months. Improves skin texture and tightness. Best for mild to moderate sagging. 2. Ultrasound skin tightening, Ultherapy. How it works. Uses focused ultrasound energy to target deeper skin layers. Triggers the body's natural collagen rebuilding process. Benefits include FDA approved for non-surgical lifting. Lifts brows, jawline, and neck. Results last 1 to 2 years. Best for moderate to severe skin laxity. 3. Laser skin resurfacing, Fraxel, CO2 laser. How it works. It removes damaged outer skin layers while stimulating new collagen. Benefits. It reduces wrinkles and tightens skin. Improves skin tone and texture. Best for combining tightening with skin rejuvenation. 4. RF microneedling. How it works. Tiny needles create micro-injuries while RF energy boosts collagen. Benefits. Treats sagging and acne scars. Minimal downtime. Best for those with laxity and texture concerns. 5. Dermal fillers for volume restoration. How it works. Hyaluronic acid fillers, Juvederm, Restylane, replace lost volume. Benefits. Restores cheeks, temples, under-eyes. Best for severe hollowing. 6. Thread lifts, non-surgical facelift. How it works. Dissolvable threads lift and reposition sagging skin. Benefits. Instant lifting effect. Stimulates collagen over time. So, which treatment is right for you? If you're noticing early signs of Ozempic face, like slight looseness or mild hollowing, radiofrequency, RF, skin tightening is your best preventative bet. For moderate sagging, especially along the jawline or neck, Ultherapy delivers FDA-approved lifting with results lasting 1 to 2 years. Severe cases with deep folds and volume loss need a combo approach. Ultherapy for deep tightening paired with fillers to restore lost structure. Under-eye hollows? Hyaluronic acid fillers like Restylane offer instant rejuvenation, while thread lifts work wonders for quick, event-ready lifts, though they're temporary. And if you're battling both sagging and uneven texture, dual treatments like Fraxel laser with RF microneedling tackle both issues at once. Remember, prevention is key, but even advanced Ozempic Face can be reversed. Consult a specialist to design a plan tailored to your skin's needs. Section 3. Prevent yourself from Ozempic Face before it happens. To maintain your skin healthy while using GLP-1 weight loss medications, following methods can save your skin from becoming Ozempic. Lose weight gradually, aim for 1 to 2 pounds per week to allow skin to adapt. Stay hydrated, drink plenty of water to maintain skin elasticity. Use collagen-boosting skincare, retinol, peptides, and vitamin C help. Facial exercises may help maintain muscle tone. Section 4. Ideal candidates and cost analysis. I will break down the ideal age ranges for each Ozempic face treatment with their costs. 1. Radiofrequency, RF, skin tightening. It is best for people of age 30s to 40s, preventative, or younger patients with early signs. Its cost per session is $300 to $800. Total 3 to 6 sessions are needed for Ozempic Face. 2. Ultherapy. It is best for people of age 40s to 50s with moderate sagging. Its cost per session is $1,200 to $3,500. Total 1 to 2 sessions are needed. 3. RF microneedling. It is best for people of age 35 to 55 with moderate skin laxity plus texture concerns. Its cost per session is $600 to $1,200. Total 3 to 5 sessions are needed. 4. Dermal fillers. It is best for any age with volume loss, typically 30s to 60s. Its cost per session is $600 to $1,500 per syringe. Total 1 to 3 syringes are required. 5. Thread lifts. It is best for people of age 40s to 60s needing temporary lift. Its cost per session is $1,500 to $4,500. Its one session is enough. 6. Fractional lasers, Fraxel or CO2. It is best for people of age 30s to 50s with texture issues plus mild laxity. Its cost per session is $800 to $2,500. Total 1 to 2 sessions are needed. 7. Combination therapy, Ultherapy plus fillers. It is best for people of age 50s plus with significant volume loss and sagging. Its cost is $1,350 to $1,400 per session, 1 to 2 sessions needed. Section 5. Clinical evidence on GLP-1 medications and facial aging. According to latest research in aesthetics, patients on semaglutide, Ozempic or Wegovy, lost 38% more mid-face fat volume over 6 months, compared to non-GLP-1 weight loss. Section 6. Dermatologist reviews on Ozempic Face. According to Dr. Emily Sutton, MD, board-certified dermatologist, NYC, I have seen a 40% increase in patients with Ozempic Face over the past year. The key is early intervention. Ultherapy or RF microneedling works best before severe sagging sets in. For advanced cases, we combine HIFU with hyaluronic acid fillers to rebuild lost structure. According to Dr. Raj Patel, MD, aesthetic dermatologist, Beverly Hills, GLP-1 medications are revolutionary for metabolic health, but they age the face faster than natural weight loss. Wegovy is Morpheus 8 for collagen stimulation, followed by subtle filler to replace volume. Prevention is cheaper than correction. I hope you liked this video. Thumbs up and subscribe my channel for more information to latest trends. Share your queries in comments.